For most people, the idea of having surgery can be quite stressful. It's understandable and quite normal. At Providence Healthcare, we want you to have the best possible treatment and experience while in our care. That's why we've made this video, to provide the information you will need to prepare for surgery, to get the most from your stay in hospital, and to speed your recovery once you have returned home. Our healthcare providers will work with you as a team to make your surgery as stress-free as possible and to get you back on the road to recovery as soon as possible. Prior to surgery, your surgeon's office will give you the date of your surgery. It's important to confirm the time of your surgery. You can do this by calling your surgeon's office after 2 p.m. the day before your surgery is scheduled. In the time before you report to the hospital for surgery, there are some important things we need you to do to ensure your safety. If you develop an illness, cold or flu, the week before surgery, you must let your surgeon know as soon as possible. Do not eat any solid food after midnight the night before surgery. For some surgeries, a bowel preparation is needed. You will be given specific instructions for this. You may have only sips of clear fluid 5 hours before the time of surgery, unless otherwise instructed. You need to follow the instructions that you are given about which medications to stop taking and which medications to continue to take, including the day of surgery. You will be given specific instructions if you need to bring any of your own medications into hospital. To reduce the risk of infection, have a shower and wash your hair with your usual soap or shampoo the night before or morning of surgery. Any necessary hair clipping will be done for you in the operating room. On the day of your surgery, report to surgical daycare at the hospital. For directions to surgical daycare, consult the Preparing for Surgery booklet given to you. And if needed, please bring an interpreter with you when you come to the hospital. Be at surgical daycare 2 hours before the time of your surgery, or at 6:30 a.m. if your surgery is scheduled early in the morning, unless otherwise instructed. When you report, please keep the following in mind. Do not bring any valuables, such as credit cards, jewelry, or more than $20 in cash. Remove all makeup, nail polish, false eyelashes, wigs, and body piercings. False fingernails may be left on. Personal items such as dentures, glasses, contact lenses need to be removed just prior to surgery. These items will be returned as soon as you are awake after surgery. Once in surgical daycare, someone will show you to a change room where you will change into a hospital gown, housecoat, and slippers provided by the hospital. You will be asked to put all your belongings into a plastic garment bag that will be sent home with the person accompanying you. If you are coming into the hospital by yourself, remember that storage space is very limited in the hospital. So please pack a small overnight bag and be sure to leave enough space in the bag for the clothes that you wear into the hospital. The surgical daycare unit nurse will ask you some questions to verify that you have prepared yourself safely for surgery. You have an important role to play in your care. We will be giving you opportunities to participate in your care and to make personal choices. You will also be given responsibility for some aspects of your safety and recovery. So please feel free to ask any questions while in the surgical daycare unit. A family member or friend is welcome to wait with you in the waiting area until you go into the operating room. Your physician will visit you. As a safety precaution, they will confirm what your surgery is and will place a mark on the site of your surgery. An operating room nurse will greet you and do a final check to confirm that you are fully prepared for surgery. An anesthetist may also visit you before you go into the operating room and make the final decision with you about the type of anesthetic you will have. Next, you will be taken into the operating room. Let the nurse know if you are cold, and you will be given a warm blanket. After surgery, you will be taken to the recovery room, where you will be monitored closely by a registered nurse. You will be in the recovery room for a minimum of 45 minutes. When you are awake and stable, you'll be taken to your room. At your room, your intravenous will remain in place until you are able to tolerate fluids, or until the intravenous is no longer needed for giving medication. Do not try to get up alone the first time after surgery. Your nurse will help you when it is safe for you to get out of bed. While still in hospital, your diet will be under the careful supervision of your doctor or nurse. It may take a while to get back to solid food. It may also take time to get back to a normal toilet routine. We want you to avoid constipation, so you may need to increase your daily water and fiber intake. You may also need to use a stool softener or laxative for a short time after surgery. Your surgeon and the rest of your healthcare team will visit you on the nursing unit to monitor your progress and answer any questions that you may have. After surgery, you can expect to experience some pain while recovering. We want to help you manage your pain to keep you comfortable during recovery. We encourage you to ask for pain medication when your pain begins. Do not wait. We use a pain scale so that all nursing staff is able to assess your comfort level. The pain scale is a simple system that uses numbers to measure your pain. 0 is no pain, and 10 is the worst pain possible. Think of any previous pain experiences you have had and try to give it a number on the 0 to 10 scale. When talking to your nurse after surgery, use the pain scale number. This will help to give you the right amount of medication to manage your pain. We also offer an acute pain service with a physician and clinical nurse specialist who can discuss available pain management strategies with you. There is also a pain management video offering information and advice about pain for you to watch on your bedside television after your operation. Exercising after surgery is important to speed up the healing process and to ensure that you heal completely. Exercising will also keep your heart and lungs in good shape and help to prevent any complications after surgery. When you feel you are able, try these simple exercises. Deep breathing. Take a deep breath through your nose. Try to expand your lower chest. Pause and then breathe out through your mouth until all the air is gone. Every few breaths, hold your breath for about 3 seconds. Do these exercises every hour following your surgery. Coughing. After your deep breathing exercises, bend your knees and support your incision firmly with a pillow or your hands. After several deep breaths, breathe in and cough sharply out. Clear any sputum into a tissue. Rest for a few minutes and repeat as long as you have any sputum to clear. Do this exercise 2 times each hour.
Yes, yes.
Leg exercises. Pump your feet up and down at the ankles. With your legs straight, make circles with your feet. Pull your toes up and press your knees down into the bed. Hold for 3 seconds, then relax. Bend one knee, then straighten it. Then do the same with the opposite leg. We recommend that you do these exercises every hour following your surgery, and continue these exercises for at least 2 days after surgery.
Okay.
Just as it is important to prepare for your surgery in advance, it's also just as important to plan ahead for the help you will need when you return home after surgery. We rely on you to plan ahead for your discharge so our hospital can keep to our busy schedule of patients. You will need a responsible adult to take you home because you have had an anesthetic. Be sure that they know that discharge time is usually in the morning. Your surgeon will advise you when you can resume normal activities and when you can return to work. Make sure that you understand any restrictions or limitations that you will have after surgery. If you have had orthopedic surgery, like hip or knee surgery, you will be given special instructions about what you will need when going home. And be sure to ask questions if you are unsure.
Arms okay? Yes, yes.
Once home, it is highly recommended that you have someone stay with you overnight. It's a good idea to prepare for your discharge well in advance of your surgery by shopping for food, planning for meals, and setting things up at home so everything is easily accessible. Arrange to have your prescriptions filled and picked up, and make sure that you understand what the medications are for and what possible side effects to watch for. If you're not sure, don't be afraid to ask questions. Professional services such as home care nursing or physiotherapy requested by your doctor will be arranged by the hospital before you go home. A social worker and other professional supports are available if you need them. For most people, having surgery can be a stressful time. Remember to keep the following things in mind before your surgery and during the recovery period. Remember to stop eating or drinking at the right time before surgery. Follow the instructions that you have been given about your medications before surgery. Communicate to the nursing staff about your pain level. Take pain medications when you first start to experience pain. Make the effort to do the exercises after surgery that you have been shown. Make sure that you have planned for your discharge home. Follow any instructions about your care after discharge from the hospital. Read the patient information booklet that you have been given for more detailed information. Most importantly, we want you to speak up and ask questions. Remember, you are an important member of the healthcare team. Your comfort in hospital and during your recovery at home are important to us. We encourage family members to share their concerns as well. Our goal is to provide you with the best possible care so you can have a safe and speedy return home.